Hi, I'm talking to Oliver Gordon. Oliver is an osteopath. Hi, Oliver. How are you?
Hi there, Joanne. I'm very well, thank you.
Good.
Yeah, nice to see you here today.
Oliver, today we are going to talk about osteopathy. Firstly, what is osteopathy?
Osteopathy is a holistic type of medicine that covers a range of conditions that, from medical to mental, let's say, and neurological. And it was devised by a man called Andrew Taylor Still in 1899 in America. And it has been spread across Europe and coming into the Middle East, like Israel now, much more. And it's recognized in England very much with medical people, doctors and nurses, orthopeds, many professionals that you might have heard of. And it's a system of medicine that encourages the body to create its own chemicals. Okay, all of the pain-killing chemicals and anti-inflammatory chemicals and things that we get from the doctor, we actually produce these in our body. So it's up to the osteopath to get the blood flowing well and the nervous system working well in order to get all of these things functioning well. And looking at the structure of the anatomy, we do diagnostics that is very specific to the tissues that have been affected with people's problems. So we find that we get to the cause and the root of the problem as opposed to just treating symptoms.
And what sort of qualifications does an osteopath have?
Well, a registered osteopath would have done at least 4 years of a university degree, maybe 5. And most of us do some studying after that to deepen our knowledge of the body. But we all do courses every year in order to keep up to date as well. And we try and talk to each other and communicate well via the General Osteopathic Council, and just the fact that we are generally nice people that try to help people.
Does an osteopath only treat adults? Can you treat children as well?
We treat children using a set of techniques called cranial osteopathy that was developed by someone called William Sutherland. And there's a very large institute in England that teaches all of these techniques, and there's a clinic which many people experience very, very good results from. And I've been studying and almost specializing with the children since 2004. They're very, very gentle techniques for the children. With the adults, there's a range of techniques that I use depending on the body and the problem. But I treat everyone from pregnant ladies, babies, elderly people, to sports people and young people and people with a back pain that have to sit in an office all day. Many, many things. So,
give me 1 or 2 specific conditions that you as an osteopath would treat.
Well, as an osteopath, we're really specialists with the joints. We're also specialists with pain. I see many people with prolapsed discs or problems with their discs. It's probably one of the main things I see. And we have a very successful way of treating them that is all natural. We use just the element of touch, massage type techniques, stretching techniques, manipulations, whatever's necessary and whatever the patient is able to deal with at the time. I see people that are very acute, that can hardly walk, and I've had many experiences of them getting off the table and standing and walking out of the clinic.
You mentioned manipulation. Tell me a little bit about manipulation. I know that's probably like a scary word for a lot of people. What is manipulation? Does it hurt?
So I get asked this question a lot. The idea with the manipulation is that we improve the nerve supply to the area that we're manipulating, which also affects all of the muscles and nerves and blood supply that is being that supplies to the body. Okay, that particular area. The noise that you hear, the clicking sound, which is probably what most people want to know what it is actually gas being released from a joint. The image I use is actually that if you get a hose pipe and fill it with water and put your fingers in both ends, then what happens and you pull one side out, it makes like a popping sound. And this is the sound that you hear with the manipulations. If they are done correctly, then they can be done in a very safe manner. And there's very, I think the statistics say you're more likely to be hit by lightning than to have a problem. But generally with the elderly, I'm more careful with these things.
Going back to the specific techniques that an osteopath or you specifically would work with, just talk to me a little bit more about those, about exactly what it is, whether it's acupuncture or stretching, etc.
So there are some osteopaths that combine the acupuncture with osteopathy. I think it's all a part of natural medicine, and the body works in many ways. So the more ways we can treat it, the better. But there is a range of techniques within osteopathy that are from very gentle, like I said, with the cranial osteopathy, which is really like just almost like laying the hands on, feeling the bones of the head, and of the sacrum, the bone at the base of the spine. And it's very, very gentle. But we do a range of things like soft tissue work, stretching of the muscles, almost like massage techniques, working with the fibers of the muscles in specific areas, trying to release the body and help it function in a better way, in a more harmonious way.
Thank you, Oliver. Thank you so much for talking to me today.
Okay. Thank you, Joanne.